you all know that the carbohydrates after 2 hours is turned to calorie, right? But a protein after 8 to 12 hours turns to calorie. So that's why protein is suggested for being full all day, and also during the fasting, and also for regeneration. Carbohydrates is a quick energy. So that's why if you want to bring the ghrelin down and also insulin down, you gotta avoid the refined carbohydrates. Stay with a lot of proteins, fibers such as green leafy vegetables, which I personally, that's my diet all the time. So I carbohydrate, I have it once a week. A little bit of rice, a little bit of bread or something. So it's not on a daily basis, because I understand the regeneration and I know my age, that I want my biological age to stay healthy, to stay intact. So quality protein and high quality fiber can reduce ghrelin levels to the point that the human brain gets the signal that the body has eaten. So this is something that you have to understand how the body works. When we understand how the body works, then we can bring everything under control. So this is the super complete anti-aging pathways. So, and from dietary to all the exogenous, endogenous, toxins, and peripheral lymphatics to fat tissues and everything. So when you watch the videos, in the future, you want to go through the course, through videos, you can focus on this, because it's going to take hours if I want to go through every single thing. But everything so far I have said, and everything that I am saying after, is this in this pathway. So this pathway is it's very, very detail oriented, and it's great to know. So the summary for the tips is detoxification of the liver is the very first thing you have. Detoxification of the liver. The reason is, no matter you're not alcoholic, you're not smokers, you're not taking drugs, you are having a good, food habits and everything, no matter what, because the liver is the project manager and is doing everything at every single moment, it needs cleansing more than any other organ. More than any other organ. It needs even more than lungs. It needs cleansing on daily basis. On daily basis, we can do it with food, such as warm water with lemon. And on a regular basis, we can do it with different system of medicine, which are naturally derived, such as homeopathy, such as chemotherapy, such as herbal mother tinctures, such as TCM, whatever is available for you, whatever is available. The only thing is that cleanse your liver, because it's a very crucial thing to do, no matter your age. The age is 14 years old, 8 years old, or 80 years old. The liver is doing the job. So cleanse the liver of your children, cleanse with food, cleanse your liver on regular basis, and because you need high IGF-1, especially when you are sick, you get sick, especially when your habit is just out of norm, especially on that time, you got to cleanse your. Even I go traveling, because I have no control on 2 weeks, for example, on traveling, what I can choose the food, definitely. I can choose the food that is best for me, but the preparation of food and so many things, and a lot of activities, a lot of emotions that I might go through is not under control. But when I came back for the first at least first week, I go on a liver drainage. I go on liver detox to get back to the, default regeneration. So IGF-1, it's called insulin-like growth factor. It's very similar to insulin. And that's why if you really want it to do this, bring insulin down. That's why, because this one is our anti-aging hormone. And high GAG, the glycosaminoglycans, I love that. The hyaluronic acid is the second anti-aging, which we needed. No matter how much hyaluronic we put on, I have my sets of skincare, the very high quality organic skincare, full of hyaluronic acid, full of collagen, full of elastin. But they're not more than 20% that can work on our connective tissues. Not more than 20%. And I can explain it to you in very details. The other 80% goes back to our fibroblast cells that make natural collagen, make natural elastin for our natural connective tissues. This is so important, and also goes back to liver to produce natural hyaluronic acid to come, between the holes, the space of the network, connective tissue network, and fill it up. The work of hyaluronic is to fill up all the spaces in our connective tissues. That's why the connective tissue becomes strong. Otherwise, it falls apart. When it falls apart, it becomes like a woman, older age, that I show you the slides. So that's how the hair connective tissues practically fall apart. Collagen and elastin proteins help to maintain insulin levels in normal or optimal. So what do we need to bring insulin in checks? A good quality protein. Because collagen and elastin are large proteins that the body makes them, but from where? From the proteins we eat, because there are 3 different amino acids that make collagen, and there are 4 amino acids makes elastin. So these are coming from food. That protein that we eat should be quality protein that the body can make collagen and elastin. Collagen and elastin, there are 2 super precious protein that we needed for everyone. Even for the eyes, for the skin, for nails, for hair, for bones, for muscles, for connective tissue, whatever. And the body makes them. So, but insulin and cortisol is lowering the production of these 2 precious. I talked about gravity yesterday, so how we can neutralize gravity, because gravity is around us. We are born into it. We are living on it, and it's always pulling us down, always pulling us down. But with protein and minerals, the structure of connective tissue is very strong, and the gravity is neutralized. Every single moment, the gravity is neutralized by our protein and our minerals. The minerals such as calcium, phosphorus, magnesium, fluorides, silica are the main anti-aging minerals. I have them all in a homeopathic form, and we have them in oligo form as well. So, but the best way is to get it from food, natural, naturally derived from food. So there are vitamins such as A, E, D, C. We need them in a large amount for our collagen production. So where do I get vitamin A, D, E? I get them, actually, I have, I show you, that's my breakfast. And somebody says, what is this? Walnuts. Do you have walnuts in Indonesia? Right. So walnuts is amazing. It's an amazing food. You can start your day with it. Not necessarily for breakfast, but I mean, it's a great food you can have, and to provide your body with a lot of good fat soluble vitamins, such as vitamin E. So do you need it for collagen productions? And also from the water soluble vitamin, you need vitamin B3. It's super anti-aging water soluble vitamin B3. And definitely you need quality and quantity, right quantity of water. So 75% of your body is water. So don't neglect it. You need hydration. You need a great hydration. But what kind of water? Is it tap water, full of metalloid, full of heavy metal? Is it the bottled water, which can be very contaminated water, because the water that comes to the plastic bottles is more toxic than tap water? But the best water is the filtered water. You can naturally filter water at your home. So everybody has a filter in the kitchen. I'm sure you all do. So there's the best kind of water, and then putting a little bit of fresh lemon in the water, it's good to go for the day. And oxygen, this is a big element that we need for a regeneration, for living and everything. Instead of going to the gym, go to the fresh air, where that there are a lot of trees, a lot of greens. Go for a long walk. This is the best way to get oxygen. So which everything that I say here is what I follow. I follow everything. I'm not a hypocrite. I'm not a hypocrite to say something and do something else. Everything that I say is something that I have been doing it for several years. So now we're going to get into the treatment, the how we can active regeneration pathway, how we can support regeneration. So a lot of tips I told you in terms of what we have to do, but when it comes to medicinal aspect of it, as a homeopath, I do it with homeopathy for the past 24 years. And I do the liver detox, I do kidney detox, I do blood and lymphatic detox. I do it on a regular basis. When I say regular basis, it depends on the person, depends on the lifestyle of the person. For example, myself, I don't drink alcohol, I don't smoke, I don't do tobacco, I don't have any drugs, any form of medications, but I do like a liver detox like 4 times a year. But the person that it has a background of, alcoholic, or background of smoking, or a lot of diseases they went through, a lot of medications they have used, a lot of surgery they have gone through. So I may ask for every 6 weeks to do it. So again, goes back to whatever is available in your hand. If herbal medicine is in your hand, go with that. If chemotherapy, go with that. If traditional Chinese medicine, go with that. In addition to the food. Food is the main one. Then go with the system of medicine that is available to you. So I always do the detoxification of endocrine pathways, especially the pituitary gland to the liver. Stimulation and activation of hormonal pathways is very, very important to bring insulin and cortisol in check. To do the activation of a stem cell, as I explained to you earlier, that's automatically is done. The body is very intelligent. When you do all this, automatically a stem cell will become active. So you have to do mineralization, because of 92% of degeneration states because of deficiency in minerals. Let me guys tell you something. When a person dies and they do cremation, and the whole body becomes a small amount of ashes, right? I don't know if you have seen it or not. So it's just a small ashes. That ashes is only minerals. The ash that left from burning a human body in a small amount is only minerals. What does it tell you? It tells you the structure of the body is minerals. What is the structure of the body? Bone, muscles, connective tissues. So this is something that we have to understand very well, that how crucial is is taking right amount of minerals through food, which is I personally get it from vegetables. I do not have supplements. I don't, even I'm a nutritionist, I do not take supplements because I'm relying on my food. But I do a lot of homeopathic tissue salts, which are the homeopathic biochemic tissue salts or minerals. So I do that all the time. So this is something that you have to take into consideration, that mineralization is the key. So when it comes to wrinkles, nobody gets wrinkles like this overnight or over weeks or even over months. These are decades, these are years and years of something is happening within the body that is going to manifest like this. So this is the manifestation of breakdown processes internally. That's why I say shrinking inside, wrinkling outside. This is something that we have to know. So not only topically we can correct this. So about fascia, I can it's a big topic about fascia, but the same thing with bones, muscles, and connective tissues. It's a fascia is a casing of the connective tissue. So when we have the connective tissues like this, fascia is covering it, right? It's a great cover of the connective tissue. If we don't regenerate, the fascia collapses too. Actually, the first thing is going to collapse. So then the connective tissues is very at risk. So these are something that we have to know anatomically, that we have to take care of this, on regular basis. So the fascia is a body structure and support, is a structure and a case and cover of all the connective tissues, and it's very, very important to keep it healthy. I call it body parts wrap. It's like it's a wrapping, our body's parts in order to make it safe and secure. And when we get to degeneration states, fascia also is going to be degenerate. So that's that's how it looks, and it's like a mesh cover of bones, muscles, and connective tissues. Okay. So we don't get into the different layers of fascia, but that's how important it is. The health of connective tissue and the wrap of the body's organs, which is called fascia. Okay, I like to. I think yesterday I talked about it a little bit. Guys, can we take a 5 minutes break? Is that okay?
Sure,
Sure, Doc.
doctor. Sure.
Yeah.
Okay.
It's okay.
So,
Yeah.
okay.
Thank you,
So
doctor.
you're welcome. So if you have any questions so far, let me know, and then I'm going to get into the second segment of my talk, and then I get to my treatment. So if you have any questions or anything that you want me to explain again, so far, because the way that I explain it, I want everybody to learn. Everybody knows now what is insulin, what is cortisol, what is pathways, what is growth hormone, what is IGF. I want to, when you finish the course, you completely, have it, clear. So who wants almond? Who wants walnuts? Anybody wants walnuts?
No, thank you. I'm
Okay.
allergic of nut, Doc.
Okay. Let me just show it to you. Do you know the look of walnuts?
No.
It look like brain.
No, doctor.
Yeah.
You see, when you put them together, it looks like brain. Oh, it's brain food. It is brain food. It's an amazing protein, an amazing fat soluble vitamin that the brain loves it Liver loves it too. I'm afraid to go off camera and doesn't let me come back. So if you don't have any questions, then
Doc, I have question, Doc.
Is
Hello.
there any question, doctor?
Yes, I have question, Doc.
okay, go
Okay.
ahead, Dr. Rahmatullah, go ahead.
Doctor.
Okay, I want to ask about the fascia. Is there the connection between the fascia, maybe from the other system like the hormone, immunity, or I don't want. Maybe because your setting is our body is the wholeness.
Sorry,
Because
Dr.
in
Rahmatullah, I
our
cannot hear you. Can you come closer to the microphone? I cannot hear you.
Okay, maybe I have.
Yes.
Okay, okay. Test, test, test. Okay, okay. Test. Can you hear me, Doc?
Yes, yes, that's much better.
Okay, thanks. Okay. I want to ask about the fascia.
Okay.
Okay. Is there a connection the fascia with the other system? Because I know fascia is only in from the musculoskeletal and for the skin. Maybe there is a connection between the other system. Thank you, Doc.
Sorry, I think you should write the questions, and because I didn't get the question clearly, so you can write it down. The fascia is just a cover, it's just the cover of the, everywhere, like ligaments, like tendons, like connective tissues, like everywhere. Is like nature always try to seal and protect
Okay.
all our organs and everything. So it's a form of layer of wrap and protection. So, but when it comes to deficiency, when it comes to collapse, degeneration and everything, don't think that this part is okay and that part is not okay. The whole body is going to go through problems, whole body. So, but again, it depends on if there is for example, a site injury, like a spot injury. Yes, maybe that a spot is more, become degenerated than the other part of the body. But in general, degeneration, in general, problems, it affects almost every single cells, affects everywhere from bones, muscles, connective tissues, fascia, and everything. So if you can write down your questions on the chat, maybe I can have a better understanding of your questions. Let me just see if okay, Dr. Ramatullah, as I said, the other system, it's mostly the connective tissues we're talking about. And research is going a lot about, new things finding in the human body, new, kind of responsibility of different, tissues of the body. But what I understand about fascia is the wrap protection of the connective tissues, including bones, tendons, skin, and everything. Let me just show you show you one of those slides. In some literature, they say body structural wrap. In some literature, they say connective tissue wrap. Some say bone and muscles wrap. But it's very important to understand that we all have protections in almost every single organs. You see, guys, hold on a second. You see that on this slide, it shows like the skin is on top layers, and superficial fascia is lower than deep fascia, then goes to the muscles. So that's how it's protecting, you know, the connective tissues between the skin and the muscles. Okay, I think yesterday also I shared these slides with doctors. It's about skin diseases. So we are not talking only about cosmetics here. We're talking about anything that manifests on the skin. Anything that manifests on the skin, there is an internal disharmony. Unless it's a burn, like you touch the fire, you burn, or you have sunstroke, or you're exposed to chemicals, that's different. But the rashes like this that comes to the surface is always goes to the internal problems. So which I always say, people that come to me, I have been treating skin disorders for the past 20 some years. So whatever I learned at the school before become homeopath, it was wrong. I learned that, okay, topically you use cortisone, topically you use this, topically you use that. That's not the answer. The problem, you have to get into the body to see what the problem is. So I learned through my homeopathic study, through the philosophy of healing, through the concept of cure, and through my clinical practice, and through my own individual research, that the majority of the skin disorders are liver problem, are all connected to the liver. Imagine that they are sometimes, you know, you eat something bad, something wrong, you get hives, right? You eat something allergenic, you get rashes. These are all the liver is throwing it, you know, to the skin. As I explained it yesterday, I say that liver and skin, they have a very intimate relationship. They're like husband and wife. You know, liver is, when it's, I say, never make the liver angry, because if it doesn't like something, it's going to throw it to the wife, to the skin. And that's how it happens. So people that come with the skin disorders to me, I always look into the liver and always do whatever I'm supposed to do to bring liver in a healthier state. So I do it with homeopathy, I do it with gemotherapy, with oligotherapy, with homotoxicology, with nutrition, and all this. But you can do it with anything that is available to you. But skin disorders, please look into the liver. Otherwise, there is no way. So definitely immunity, because liver and immune system, they have pathways. So these are collaborating. Liver and skin and immune system and nervous system and central nervous, they don't work separately. They all work together. But the direct affinity of the liver and skin, it's absolutely obvious that how important is this. And sometimes psoriasis, sometimes, you know, it's an autoimmune. Why the immune system is immune system should be the most intelligent, vigilant, and wise system of human body. Why becomes like that? That is wrongly attacking its own cells because of the problems and blockages on the pathways. So that pathway, through my studying practice and everything, that pathway is liver and skin. That's why immune system is wrongly attacking the skin in a case of like psoriasis, in a case of lupus. These are something. I have a lupus patient, is because I'm very busy with a lot of skin disorders patients. So one of them actually is booked because I normally book it for 3 months ahead of time. So, but it's coming June the 3rd. This patient has been for over 20 years. It's been dealing with skin disorders and lupus and everything. So, and with through my talks that I have with for a lot of medical doctors in the United States and Europe, they ask the patient to come to me because the high rate of success in the treatments, and that's why I'm so happy that I can help this kind of patients. So when patients come to me, I always go with homeopathic medicine. Homeopathic medicine are in different forms, in a form of single remedies. We call it remedy because homeopathy is not a medication. Homeopathy is a remedy, means it's helping. It's helping the body comes into homeostasis, come into alignment, come into balancing, and removing the disharmony. Disease means the body is not at ease. It means disharmony. So, and when there is disharmony inside the body, there is no homeostasis, there is no alignment, and there is no balance states. So, single remedy, which is the classical homeopathy and is a very, very, very detail oriented to understand the person, because I do not treat the disease. I treat the person with, for example, whatever problems they have. So with this remedy that I chose, it's chosen for the person. So the person according to the all levels of physicalities, including lupus, including psoriasis, including degeneration of any part of the body, and the mental states, including the emotions and the state of mentality, the thought process and everything, and the level of emotions. If they are living in a anxiety state, they're living in a depressive state, they're living in a bipolarity state, what kind of state they're manifesting their mentality. And also I take into consideration the non-physical aspect of the person. That's why I get into the personality of the person to understand the non-physical aspect. Then I put them together, all the levels in order to understand the person. Then I come up with one medicine, only one medicine for that form of alignment. This is a very fascinating system of medicine. When you learn it, when you become a homeopath, you will change it to anything in the world, because then you understand that treating the person is the key, not treating the disease or only pathology. That person has this pathology. The person has this pathology. 10 arthritic patients come to me. They get 10 different medicine because I don't treat arthritis. I treat the person with the arthritis, because not everybody manifests the arthritic pain the same, or the same locations, or the same level of severity, or the same chronicity. They don't. That's why the person with arthritis is going to get a specific medicine, homeopathic medicine. That's fascinating to know. And I do homeopathic minerals, which in a form of tissue salts. So I do mineralization, I do detoxification by these minerals. I use a lot minerals such as calcium fluoride, calcium phosphorus, silica, according to the person mineral deficiencies. So with the biofeedback scan that we all use, we can understand the level of deficiencies of the patients, because again, the person is deficient, not just give them through minerals on the person before we understand the patients. I have a lot of patients that coming with the same name. For example, Hashimoto's, such like Graves, like diabetes or whatever. They don't get the same medicine because according to the patient, the person, and the level of deficiencies, I prescribe something. I do a lot of homeopathic organotherapy. We call them sarcodes. They're coming from live tissues, and in order to stimulate the organs, such as thyroid, such as pancreas, such as adrenal glands, pituitary gland, hypothalamus, everything, and also do a lot of oligotherapy, which is again another form of mineralizations, which are trace minerals. They're mini doses. I never go with mega dose of anything. From food to minerals, I always go with the mini dose of minerals, because minerals can be very toxic to the liver if you're using it too much that the body needs. That's why if you want to really be safe, you always use either homeopathic minerals, which is in the nanodoses, or oligo, which is the trace minerals, which is the low doses. So that's why, I have been doing this for the past 3 decades. I never use just mega dose of minerals such as zinc, selenium, this and that. No, because they can be toxic if you're too much into your system. I use gemotherapy, like such as Joplins regia. I use trace elements, zinc, nickel, cobalt, to keep the insulin level low. If you want to keep the insulin and cortisol level low, the best thing is gemotherapy and oligotherapy. These are the 2 things that quick bring them in check. So, and also I work a lot in, no matter the patients, no matter the diseases, no matter the name of the pathology, no matter whatever, I always work on the nervous system of the patient. Always try to bring the pathways of the central nervous system to the other organs under balance state. So that's why I do it. I do it quickly with homeopathic and gemo. So I do a lot homotoxicology. Homotoxicology is another branch of homeopathy. I heard that homotoxicology is a lot in Indonesia. One of my professors who is working with Malaysia, he told me that they have homotoxicology, which is a form of homeopathy in Indonesia. So at this point, if Dr. Otami wants to know exactly where you can find homotoxicology, I can introduce you to one of my faculty who is working with Malaysia. And then he can tell you exactly where you can find homotoxicology, which is an amazing system of medicine for detoxification. So I do detoxification with homotoxicology, and I do the drainage with gemotherapy. So these 2 are amazing systems. If you can have them handy, you don't need anything else. You just don't need anything else. So these are the homeopathic biochemic minerals that I've been using them for the past 30 decades. Myself, my family, my children, my patients. I never go without it, because mineralization is something that we needed on a daily basis. But I go with homeopathic mineralization because it's very, very, very safe. And another one is the gemotherapy for the cellular drainage, as I said, and detoxification with homotoxicology, and gemotherapy, drainage with gemotherapy. These 2 going together, because detoxification just alone can be very risky if there is no drainage. So we have to open up the boundaries with chemotherapy and do the detoxification with homotoxicology. So oligotherapy is another things that I've been using it since I became a nutritionist 30 years ago. It's always been in my practice for any form of conditions. People come because these are amazing for enzymatic actions. They have structural actions. They have metabolic actions, and they're amazing for mineral deficiencies. You can find them anywhere in the world, and I'm sure you can find them in Indonesia as well. So these are my treatments that I do. For regenerations, I do, as I said, homotoxicology. The very first thing I do the hepatic pathways to cleanse and support liver, gallbladder, and hormonal. I have a specific medicine for it. It's very available around the world, actually. I have patients in United Kingdom, I have patients in Asia, I have patients in Middle East, and they can get it easily. Like the one that I'm using, there are a lot in Emirates. They can find they're everywhere. They're in Europe, they're in Asia, they're in. I heard I have patients in Japan. They said they can find it in Japan. But I mean, what I'm using is more available in Canada and the United States. But the main thing I want you to know is that what the procedure is, the process is the liver hepatic, detoxification is the very first thing you have to do for quantum anti-aging. Then the kidneys, bladder, hormonal, I do it again with my own homotoxicology that is available in my country. They're available actually in Europe, in the United States, and in many countries. But I mean, I have been using them for the past 20 years, and with the great results. So I never do liver drainage just alone, because liver and kidneys always collaborating, always collaborating. Either I do them do them in a separate timing, or I do them according to the patients at the same time. So for cortisol and insulin, again, I repeat that we have to bring them into balance, otherwise regeneration stops. So it's very, very important to do this. The very first thing I do is to bring cortisol and insulin into balanced states. I do it again to recap. I do single homeopathic medicine. I do homotoxicology. I do sarcodes organotherapy, which is homeopathy. I do homeopathic minerals, and I do chemotherapy, oligotherapy, food, nutrition plan, and genetic diet. The genetic diet that I have been using it for the past 30 years is based on the blood type. I'm sure that you can find a blood type book in Indonesia or Amazon. It's going to help you a lot to design a program, a diet program, nutritional plan for your patients, which is according to their genetic code. I personally have been living on my blood type diet for the past 30 years, and also almost more than 85% of my family also living on it, more than 85% on the blood type diet. So this is something that I think it should be the first step for all doctors to move to blood type diet, to genetic diet, for many conditions, such as inflammatory conditions, such as inflammatory diseases, because the genetic diet is designed for your blood type, and it's amazing. So as I mentioned, I do homeopathic organotherapy a lot for the activation and stimulation of the organs, from hypothalamus, pituitary gland, to thyroid, to pancreas, to adrenal glands, ovaries, testes, prostate, everything. So I do that because I treat the person. I do not treat the disease. The person is diseased. So that's why I have to get into all the endocrine pathways, all the hormonal pathways, in order to remove the disease. So Is it hard? Absolutely not. The only thing you have to learn it. If when you learn it, it's not hard. Then the person, in the next few days after, say, they come with improvement. Again, next week we come improvement, because that's the result of treating the person. So I do, as I said, organotherapy. We call it glandular homeopathic medicine. There are Sarcos. They're amazing. I've been, even before I became homeopath, I started using them because you can, in Canada, you can find them over the counter. But again, even there, you have to, ask for somebody to give it to you. But I mean, it's not that just go and pick it up. But Sarco remedies, in many cases, they need so-called homeopathic medicine, which is I use it a lot for children. A lot for children in order to, especially the children that they stop growing, they stop, their growth hormone is not adequate. So I use Sarcode in order to stimulate the pituitary glands in order to produce enough growth hormone. I use a lot of, I recommend a lot of collagen liquid in people that they are very long-term degenerated. Is in a form of amino acids. The name is collagen. Don't get it wrong. Collagen is not ready. Collagen is made in a fibroblast cell. It's made inside the body, but they name it, collagen in order to, because it resonates with people. But this has, amino acids, glycine, proline, and hydroxyproline. These are the main amino acids inside this liquid that they goes to the body, and the body makes collagen from it. So I personally use it once a year. Personally, I use it like not necessarily a full bottle, but I always order one bottle for the whole family, and we use it. I may use it like for a month or a couple of months in order to just supplement the amino acid that I need for my collagen. So natural collagen is made of this amino acid by the fibroblast cells in papillary dermis. So collagen is not coming from outside; it's just made inside papillary dermis. For the collagen production, as I mentioned earlier, we need a giant amount of vitamin C. Giant amount of vitamin C, a lot of vitamin C, but not the vitamin C as supplement. If you use the vitamin C as supplements, you're not getting anywhere. You need the vitamin C that comes from food. I use leafy green leafy vegetables a lot. Like it's going to be like my meal, like a big, not salads. I'm not talking about leafy green vegetables, like a baby organic greens. They're full of vitamin C. Lemon, lime. This is amazing. Just one lemon, it gives you a good vitamin C for the day. So I use those when I am having collagen and collagen liquid. But again, collagen, you can get it from animal source as well. You can get it from chicken. You can get it from meat. You can get it. These are coming naturally from animal source. But there are people that they are vegetarians. Sometimes I become vegetarian. I'm not a vegetarian, but sometimes I become vegetarian when I'm fasting. Then I get the liquid collagen, for a while. So the fat soluble vitamins such as vitamin D, vitamin E, vitamin A, vitamin K. As I said, I don't prescribe that. I highly recommend to go with the high quality such nuts and high quality food to get enough fat soluble vitamins. But if somebody needs it, then I give it a temporary, like for 3 weeks. I give the supplements in a very, minute dose, which I have you know, that I have a slides here, is in a form of drop. I don't give them megadose in a form of drop, just 1 drop a day, so they to get enough of fat soluble vitamin. And the water soluble vitamin, again, as is required, water soluble vitamin, because it's washed off through the kidneys. Sometimes the majority of people are deficient in it, and sometimes they really need supplementations. And then I give again in a form of minute dose, in a form of drops. I don't give pills, I don't give capsules. I give drops, 1 or 2 drops a day, because it can be toxic as well if the kidney is already having a problem. So we don't want any of this to the body. So if the kidneys are okay, they're functioning well, everything, the best way is to have it in a form of drops, not in form of capsule or caplets, or in a form of powder. Powder is okay too, but I personally go with a drop, and I ask them to have like very minimum drop a day in order not to have so much, you know, load on the kidneys, because, you know, the byproducts of water soluble vitamins goes through the kidneys, and we don't want to overwhelm the kidneys. Okay, I have protocols for regeneration, anti-aging for male. I have regeneration for female. I have regeneration protocols for people that they go through cancer. I have regeneration protocol that people go through surgeries. I have different regeneration protocols for different conditions. So my male protocols is different than female. So that's why. That's why it's my regeneration protocol is very famous in my country, and I'm very busy with creating the protocols for them, and it's amazing result that, you know, I never advertise for my practice, never did. It's always by word of mouth. It's always by referral, because people having great result with it, and it's a life-changing thing. So that's why people love the treatments I offer, and it's very safe. It's very, very effective, and not too long. So I have a special male medicine for male pathways. So I know we all are humans, female, male, we are humans, but when it comes into pathways, we are male and female. So then not the same treatments. And for male chemotherapy, I have a special male chemotherapy medicine, and some of them that might be the same for female, but different frequency and different dosage. These are male chemotherapy remedies, which I use a lot. We have been using for the past more than 2 decades, a lot. The female protocol, again, and the endocrine system in the female is different than male. So to regulating the metabolism, to regulating the pancreas, digestive enzymes productions, and the cortisol level, insulin level, and everything in female is different than male. So I have different sets of medicine for female. So they're not similar to male. It might be 1 or 2 might be similar, which is the general ones, but when it comes to a specific one, they're not the same. Again, some GMOs might be similar, but some GMOs might be general, some GMOs might is very specific, such as rubicitis is very specific for female, and for male it was different. When it comes to internal degeneration in cancer patients, that it's an advanced atrophy state, advanced degeneration, then my approach is different. I do the general after I do the specific. So for the advanced atrophy or advanced degeneration, especially in cancer patients, I go with the main treatments first, then I go with the general treatments. Again, from female to male is different, from internal degeneration to external degeneration is different. You see, the internal degeneration, I use number 48, but external degeneration, I use number 49. But again, this is very, very specific treatments, and is specific treatments for male and female. And instead of starting the general treatment, and I start a specific treatment in very advanced degeneration. Advanced degeneration, for example, my lupus patient, or chronic psoriasis patients, I go with external advanced cellular degeneration. Then I start the general ones. If it's a female, I go with the female pathways. If it's a male, I go with the male pathways. So, but the internal degeneration and external degeneration, it's a very, very, very specific degeneration protocols. And I personally have done a lot. But again, because I treat the person, again, I have to go through a lot of study with the patient to really understand, to really come up with the right dosage and frequency for that patient. So that's why, that's how I treat cancer. That's how I treat malignancies. So stem cells, as I mentioned yesterday, that we all know the stem cells activation is something that we do. Every day the stem cells are ready to be activated. I do it with homeopathic medicine, and this is amazing. So I have homeopathic medicine that it's activating the undifferentiated stem cells in the bone marrow, or in the nervous system, or in the heart, or the vascular system, or even the skin. So with the system of medicine that I have, the homeopathy and homotoxicology, I choose the best one, the best closest one, in order to activate the stem cells. I wish that all you doctors can come to our international conference in July 12 and 13, and I'm going to share my view and perspectives about activation of the stem cells with homeopathic medicine. Nutrition, as you know, it's the main key to everybody's health. As I always say, your healthcare starts from your kitchen. Your food becomes you. Whatever you eat becomes you. And that's why it's very, very important, very crucial that to take care of your nutrition, and what's the percentage of the food you're taking, how much alkaline food, how much acidic food you got to take, because degeneration and almost all diseases takes place in acidic state of the body. If the body is in a neutral balance body state, it means it has homeostasis. But when it falls into acidic level, degeneration starts, disease starts, aging starts, everything starts. So again, we have to correct it with food. But the problem with food is, especially in modern societies, the food is very depleted. We don't have enough nutrients that comes from food. But again, in general, the best ratio is to have 70 to 80% of alkaline foods, such as vegetables, and 20 to 30% acidic food, which is animal meat. So animal meat should be 20%, vegetables should be 80%. So again, protein and minerals. Again, protein and minerals are our strength of connective tissues. So pH balance is very crucial. I teach pH in orthomolecular nutrition. It's fascinating to know how you can correct your pH balance, and how the pH balance can make you sick and without knowing. So this is something that I teach in nutrition, And in case in the future you want to have, a course of nutrition, I go with, hours of pH balance. So because it's very crucial in anti-aging, it's very crucial in regeneration process. As I mentioned earlier, pure water is something that is a must. 75% of your body is water. You are living on water. So, and this is the water in our body has to be pure. The water is doing amazing job for us. It's keeping us alive. It's transporting everything. More than 90% of our blood and lymphatic is water. So the water inside us should be pure. That's why detoxification is something that we have to do it all the time to keep that 75% pure. But the water we're drinking also has to be pure. It has to be in good quality, not the tap water that is full of heavy minerals, not the contaminated water in like a plastic water, plastic bottles. It just has to be a very healthy filter that we all have it at home, right? Healthy filter just to filter the water. So because we need it for our everything, and we need it for hydrations. So otherwise, our network of connective tissue collapses, and ultimately is causing degeneration. So again, stem cells activations is, I personally, that's my regimen that I do. It's a very, very important tips to do endocrine pathway detoxification. I do it for myself every 4 months, even though, as I said, I don't drink alcohol, I don't smoke, I don't have any medications, I don't have anything. I have a very healthy lifestyle, but still I do it because when I go out, I am exposed to pollution. When I travel, I don't know what I'm eating. So there are a lot of different things that still we can be at risk. But every 4 months or minimum, minimum 3 months, 3 times a year, we should do detoxification, no matter how healthy we are. So the liver drainage, it's amazing to do it with fresh green vegetables with fresh lemon every day. I do fasting. Personally, I'm just trying to give you my own practice, my own experience that I have. So I do vegetable juice, green vegetable juice, such as zucchini, such as celery, such as spinach, such as kale, and everything with fresh lemon for 3 weeks. That's my fasting. So I just drink it through the day, and that's my fasting. And then I stop. Then if I need it again, I repeat it. But I don't mean that you should do it all year round. So just do it as much as you can. Even you do it 3 days, even you do it 1 week, this is still helping you a lot to rejuvenate. So we always have to keep our body fat, in a small amount because we want IGF-1 to be higher. So that's why weight loss, not weight loss, fat loss. The weight loss is a wrong terminology. Weight loss means you're losing bones, you're losing, muscles. No, fat loss, because too much fat is blocking the IGF-1 and is causing aging in us. So that's why you have to always.
Gimana, Beb? Mobilnya lupa.
Okay, I'm just gonna
Dadah.
mute. Okay, Dr. Ostri was, okay, and intermittent fasting is very, very great. Intermittent fasting, the window of like 16 to 18 hours is amazing, from tonight to tomorrow morning, not to eat anything, only drink pure water. And also if you can fast on green vegetable juice, it's amazing. Again, I repeat and repeat and repeat that lowering insulin hormone, you should be your primary things, and also lowering cortisol hormone should be the primary work for your regeneration. So quality of sleep, as I mentioned before, It's amazing. 3 hours prior to your sleeping. 3 hours prior to sleeping, you're not supposed to have anything because you want to bring insulin down low. If you eat a bite of anything, your insulin surges again. You don't want a spike of insulin. So 3 hours minimum before sleep, you should go without any food. Water is okay without any food or medication or anything. So if you really want to regenerate in a best possible way, that's how you should stop. Okay, and high intensity interval exercise as well. Like personally, I like weightlifting. Weightlifting just for 5 minutes, 10 minutes. It doesn't have to be hours or just a very short period of time. You can do lifting a little bit in order. It's a high intensity for a very short period of time. It's regenerating IGF-1. And again, high minerals rich food. Minerals is the key to your health. Minerals is the key to your regeneration. And minerals is the key to your homeostasis. Protein is amazing. Protein without protein and without minerals, are all connective tissues collapses. So we need a good protein. I personally choose a lot of salmon, fish, which is for me. I'm not a big fan of red meat, but time to time I like to eat it. But I mean, on a regular basis, I love a high quality fish with green vegetables, which I get my enough protein and I get my enough minerals. So then the connective tissues is very happy. And don't forget your fresh lemon as well. So also, as I mentioned earlier, the body blood type diet is very crucial to know. And I wish that you all can get the book of blood type from Amazon. So try to bring sugar low. Sugar is killing. Sugar is like heroin. Like it's like a drug. White sugar is like drugs. It's killing the cells. Just try to avoid it as much as you can. Alcohol, the same thing, because alcohol turns to sugar. So these are something that I'm sure that you know that, but I have to repeat it. So again, digestion. Please work on digestion. Digestion is the key. Digestion is your second brain. Is practically we have two brains. One is here, one is in a solar plexus. We have two brains, and these two are collaborations that work together all the time, and that's why these two brains should be intact. These two brains should work harmoniously. So digestion is very crucial to every single moment of health we live in our lives. So that's why the best way is to keep your digestion is your food. The food is keeping your digestion healthy or make your digestion sick. So otherwise, we have the enzyme. Otherwise, the organs are working for us every single moment. They give us everything we need. The only thing that we have to choose the right food, which is your genetic food. So if you choose your genetic food, it's a big step towards your health. So then your digestion is at ease. Fasting is very important for digestion health because you can't eat all the time. The digestion gets tired like anything else. So keep it at rest as well, and to rejuvenate. And so that's why it's very important to keep your digestion healthy. So definitely, no smoking, no drugs, no alcohol, no substances, too much coffee. I'm not against coffee. I am, I love the smell of coffee and everything. But I mean, some people, they're living on coffee. So which is can dehydrate you. Because coffee takes the body very quickly to the acidic pH. Very acidic. That's why it should not be drink in the early morning, because when you get up early morning, your body is in the maximum acidic state. So you have to drink water Sorry, is everybody there?
Yes,
Yes.
Doc.
Yes, doctor.
Yes,
Yes,
doctor.
doc.
Okay, I
think
don't know